So welcome back to another episode of Simon Says. And the last episode, which we just dropped off like a few hours ago, we were talking about the citizen journalism, vigilant thoughts. And one of the things that we spoke about, Lyra, was that, we are seeing a lot of, people, healthy people just having heart issue and things like that. And we're saying that, hey, we should get Lan Xi to come back. So here is Lan Xi joining us today.
Hi, good to be back.
and so we want to go straight into the topic, because on a daily basis, we are talking about just in a general observation kind of sense, just a great increase, and of course, in recent time, it is a NFL player, Damar Hamlin, was of course the highest profile.
Yeah.
Obviously heart issue, but they are not using the word myocarditis. So Lan Xi, maybe you like to just let all the viewers and listeners know, what have you been seeing out there?
Well, now you don't have to be a medical doctor to detect all this. I mean, if you read and follow news enough, then you see that there is an increasing number of young athletes dying, as if every week at least you hear one.
Mm-hmm.
And more often than not, more than one. It's almost every 2 or 3 days you hear someone young and just died and collapsed suddenly and don't know what's the cause. So like Hamlin case, I mean, he's one of the more fortunate one where he responded to all the treatment, the resuscitation, and made it out of hospital. But I can't help to wonder, but what is the implication on his career, in coming times. I mean, if I collapse like that in the middle of the field, I would think twice before I go back to the field. And would it happen again? And I just think how all this while the medical, the healthcare advice has always been just take the jab, because the myocarditis risk is very rare. They started off saying it's very rare. Now they say, actually it's more frequent and it's more than we think, the risk. But still they say it's mild. It's so mild that, you just get a bit of discomfort in the chest and take Panadol, keep yourself hydrated, just rest and avoid exercise for a week, and then you'll be back on track again with no complication or whatsoever. And if complication happens, it's going to be very rare. That was their advice.
Mm-hmm.
No, I mean, it's interesting that you were saying that a lot of it has to do with mild myocarditis. But the thing is, a lot of time the public is actually being taught or educated that even you see it in the mainstream healthcare publisher, they are just saying that getting COVID-19 increases the risk of myocarditis. But so perhaps that is that general perception that people are getting.
Yeah. I mean, as with many other viral illness, there is that risk of myocarditis, but it's rare. It's rare. Now, I mean, the advice is that there is that correlation that has been established between the jab and myocarditis, because you have a group of people, for example, especially the younger men, who has not had COVID infection, but many of them had myocarditis and many died, actually. I mean, if you look at Australia, some of the reports are starting to come out from TGA, for example, and some of the Americans' reports, and Germany and UK. Many who has not had, who is not infected, but they got a jab, and some die within days after the first jab or second jab, and then the booster and things like that. Yeah. So then there is the other group who had infection, and the expert tell them go get a jab nonetheless, because it will help you to prevent some more infection. But this group of people, if they get a jab after having an infection, they are at much higher risk of getting myocarditis. It increased the myocarditis risk by at least 20 to 30 times more. Wow. And you'll be thinking I mean, COVID infection in a younger generation is so mild, and they most of them recover without any treatment. Why do they even need the vaccine in the first place? And moreover, if you had an infection and you already have the more superior natural immunity, I mean, we talk about all this, why get a jab?
Now, I know it's like if we talk about these kind of things and people will just say, oh, you guys are talking about conspiracy theory, you guys are very extreme.
Anti-vaxxers.
Yes.
Yeah, but I guess what we are really talking about is the risk-benefit analysis, which I think nobody really wants to talk about it. And remember the days when the vaccine was being pushed out, they just want to say, just take it. But we're going to go into that issue and talk about the corruption or the big pharma. I mean, there's no other word other than corruptions in collusion with government. And of course, more and more that is coming out. So so I guess from your summary, would it be fair to say that you agree that we are seeing a trend and more evidence coming out, even more mainstream media and even medical authority? Do you foresee that eventually there will be so much evidence that people will not be able to just kind of stonewall around it and just ignore it?
I mean, with COVID, anything can happen. I mean, with the jab, they say it has 95% efficacy.
I mean, we know that's bullshit. And
correct. Total bullshit. It doesn't prevent any transmission at all. But the mainstream media and so-called experts are still quite reluctant to acknowledge it.
But you do see a shift in the trend. I mean, you were saying that even your colleague who was very pro-vaccine are also now starting to question because...
Oh, keep quiet. When you present certain facts to them in the past, it's always like, no, it's not like this. But now they just like...
But that shows a shifting of positions. That shows the evidence demands a verdict.
Yeah.
And I think, so with that, I think we want to look at some article because different article and now, like you say, it's already appearing in mainstream, So let's show the first article, okay? And the first article, I think, is going to be on the screen. And you read, NFL Players Association, of course, we talk about Damar Hamlin, urged to screen for health issues over vaccine side effects now. Now, maybe Lan Shi can just quickly go through, to just summarize the article for the benefit of the listeners and viewers, and then we can discuss about this.
Yeah, I mean, with all these players who just suddenly collapsed in the field, many of them died, unfortunately. So NFL Association is being advised to screen some of their athletes for heart-related complication. Well, quite likely, I mean, I would put it is from the vaccine, hence myocarditis, pericarditis, and eventually the complication that arise from there. They can get scarring from the tissue, and then some of them, quite likely, in my personal opinion, would suffer from like a fatal type of arrhythmia. But back to that article, so the cardiologist is suggesting that the athlete should be given that option to opt for screening, especially if they are symptomatic or they were symptomatic at one time. And what we want to ask here is, by doing this, can we prevent more sudden death? Among the young athletes, among the young adults, if they get a jab and they had symptoms suggestive of heart-related type of complication, should they seek medical help? Should they seek medical screening?
Yeah, it's very interesting that in the same article, they quoted Hamlin also. He declined to convey what was being told to him, medical advice. So I think there must be big implication. In fact, even as I was reading this article, I started to think, are the NFL teams even directing the players not to have tests?
Could be.
Yeah, because it might be in the contract and you can't do certain things to trigger. So, I think time would tell. Then, of course, I mean, if you look at the whole article, who is the guy they interview? And he was just saying that, look, he can understand why people don't want to screen all the athletes because of contractual liability. Suddenly you found out a whole bunch of players have heart issues. I mean, it's like the elephant in the room, and in legal term we say you're opening the floodgate.
Yeah, that's right.
And you have seen many judges, even lawyers, they will use this as a public policy justification to say we shouldn't open. But isn't that just like an ostrich in a hole kind of mindset?
Yeah.
I mean, if you are in the player now, of course, I mean, in fact, I went to read some of the comments, okay? Article, the comments are the more interesting one. And some of them would just say, just go and screen. So that makes me think maybe there are some restrictions.
I would say the restriction would be more of a economic
Of course.
type of implication. I mean, as a player, if you had a positive heart screen, for example, how are you going to navigate your career? I mean, are you allowed to continue to play? Are you going to be like Hamlin like that, just suddenly collapse in the middle of the field and that's it,
Yeah. I mean, if you're someone like him or some very high profile, you have long-term contract, your financial security is secure. But imagine if you're like a high school prospect, you are a college prospect.
That's right.
You are at the beginning of your career, you have not earned a single cent. Do you want to do this kind of screening that may jeopardize your deal? But then again, it's like either that or do you want to have a certain cardiac incident? So
no, that's why look back at what the cardiologist say in that article. He suggested that those who had symptom should be offered voluntary screening.
So would that be your advice to? I mean, of course, we know the young healthy male. So presumably we are talking about 20 to 30 years old.
Yeah.
And so if there's a symptom, obviously go and check it out, I think.
Well, interestingly, because I recall one case that I saw in hospital. It's just a young lady. She's in her mid-30s and she just had an operation. And we were called to attend to her because she just came out from the toilet and she said she has a chest pain. And then when we checked her blood pressure, when we checked her heart rate, and then we noticed her heart rate actually was as low as, it was below 40. Her heart rate was hovering about 30 something.
Very, very slow.
Which is very slow, and her blood pressure was on the low side. And it's symptomatic, meaning that is why she's having all this chest discomfort and things like that. So upon further questioning, we found out that she actually has been having that symptom since she got the booster jab. She said her health just went downhill quite immediately after she got her booster jab. And mind you, this person also recovered from COVID just before her booster. And what she said was, I got a jab, and after that, every time when I come back from work, I had this chest discomfort. If I strain myself, I had chest discomfort, I have to rest, I have to sleep. And I was just thinking, if she slept and her heart rate just went down without recovering, would she just die in her sleep?
Yeah.
And cases like, and then eventually we have to refer her to IJN, the Institute Jantung Negara, for screening and to continue to follow up on her heart and things like that. And I can't help but to wonder how many of these cases, but they are not detected. And I was just talking to some of the colleagues, and I said, I say it sounds like it's vaccine related injury, but no comment from the floor.
Yeah, because we have been talking about how people are conditioned, and this is really a dangerous trend because now you are conditioned to accept harm.
Yeah.
And we're not talking about any kind of harm. This is a systemic government, big pharma, collaboration, if you can use that word. And so I think this is just the right time for us to look at the next article. We can show the Daily Cloud one, and it reads, breaking news. Australia's drug regulator hid vaccine death from the public, concerned that disclosure could undermine public confidence. Hello, excuse me, if you have data that shows how crap the vaccine is, of course it's going to undermine public confidence because you as a regulator approve it in the first place. I mean, to me, from the strictly legal lens, the drug regulator is in criminal liability.
And this is not a proper informed consent. I mean, if you hit certain risks.
Yeah. And this is talking about, at the FDA level, at a testing level.
Yep.
And so that's the thing, in Australia, they do have Freedom of Information Act that allows greater disclosure. But even then, they are doing all kind of things because you can always apply to the court to say, this concerned national security, this concerned public interest. So in a way, I would say the government can get away with this kind of behavior because people allow this. People kind of make it like it's the end of the world if you don't take vaccines. But if your life is, you know, on the balance, are you going to take it? No, I think those have taken it is a bit too late already. But we are concerned about the next thing that they're going to do, and people need to be smart about this because you are seeing a scrambling, and that's why I remember we say towards the end of last year, you start to hear the word amnesty, COVID amnesty. Amnesty for what? If you're so confident about what you have been doing, obviously they are so irresponsible or worse, they are malicious or both, and time will tell. So this one is just, I think, so in the end, the article, they were forced to review, right?
Yeah.
They were forced to review certain death report. But even then, okay, Lanshi, let me ask your opinion because now, of course, every time we want to go through the whole pool of data, you know, it's really swimming against the stream because you know they will do everything and anything to minimize the impact. So, for example, we had death, but you know, it's a few thousand and only a few. You know, they want to limit causation. They want to limit the link. So now, obviously, we have not seen all the data. You know, we are not in the data line. But do you get that kind of feel that the authority are always scrambling? I remember in the early days with our health ministry, every time the data came out, you know, we're just laughing at them how they constantly manipulate, but you know, those with an eagle eye are able to discern.
Yeah.
Did you think it's still like that, or is the tide changing? Are we going into some, you know, the word here, concerned people will really whistleblower? You know, we kept asking, where are the whistleblower?
I think I hope the tide is changing.
Mm-hmm.
Probably it is, but it's a bit too slow, I think. And I think somehow more of these cases are coming out from overseas, from America, from Australia, from UK, from Germany. Locally, I mean, we don't hear so much of it.
But you have a theory, right? Why? Because of the type of vaccine.
Correct. Because of the type of vaccine. Number one, I think at least half of our population are vaccinated using
Inactivated.
The inactivated, you know, something like Sinovac.
Mm-hmm.
And then also remember when the mRNA vaccine came out that they say the vaccine need to be stored at a very extreme temperature because I think some minus 75 degrees Celsius or something like that. So if the vaccine storage is compromised, you know, how effective is the vaccine, and hence, you know, if some of the mRNA fragment is not so effective, I don't know whether that limit that type of damage. And it also seems like one of the mRNA vaccine, you know, Moderna, has a higher dose. I'm not sure whether it has a higher risk of myocarditis. Definitely the risk of myocarditis is higher with Moderna, but I'm not sure the death that is related to Moderna is higher as compared to Pfizer. So all this, I think, has to be taken into the consideration.
Yeah, I think actually what you just say highlight the reason why vaccine development takes so long.
Correct.
And you need to test by stages. So, you know, whoever is, say, even President Trump, who is so proud of his Warp Speed project, I mean, I would say it is wrong. You know, it is wrong to push the program so quickly without sufficient result. And some more, they are stonewalling and they are not even admitting because I think, imagine if you can create causation, you can create that link, what kind of legal floodgate? Literally, you might see some big pharma go bankrupt.
Yeah, that's right.
And so I think with that, the next article kind of linked to that. So why don't we show a next article? And now we show from CNA, because CNA is more mainstream. Lyra, maybe you want to just go through the article with us, or you have it? Okay. No, let me just read it. I think it's on. Okay. I think that it's like the article is called "Sudden Deaths."
Yep.
Why do seemingly fit and healthy people die for no apparent reason? Now, actually, I think we're not really interested to go through the whole thing. You can read it yourself. But I want to put it to you, Lanshi, that, you know, they say anything and everything except vaccine. So, okay, here's my question. Are they trying very hard to not link with vaccines, or, we're talking about medical people, we're talking about smart people. Are they suddenly realizing, oops, maybe, just maybe, the vaccine is crap? And if it turned out to be true, what kind of floodgate would it open?
I would say it's like a disclaimer. When you have to insert the fact that it has nothing to do with the jab, it's a disclaimer. I mean, why do you even have to mention it? Obviously, it's on the mind of many people that this could be the vaccine. It's just like in the beginning of the days when they roll out vaccine, they say, no, you get a jab, you are not going to get COVID. We know it's bullshit.
Yeah, and
probably this is another level of bullshit that they have to swallow with time.
I mean, what they're always saying is that there's always that underlying heart diseases. But you were saying earlier on, before the recording starts, that, most of these, the parents, even the family members that came out and testify that they are just saying that, look, they are perfectly healthy. And none of all this came as a shock to them.
And Lara, exactly right. So when people come out and give this kind of comment, I think it revealed their unhappiness already.
Yeah.
And that's why in this article, it pointed out to creative technology founder Sim Wong Hu. Creative Lab Sound Blaster. He's a legend in computing industry. And 67, not young, but he ran marathon and things like that.
That's right.
So now, of course, the family declined to speak to media, and always the case, they want privacy and things like that. But the fact that they would even say he appeared to be well is so shocking and unexpected. I think it kind of revealed the unhappiness.
That's
and maybe this sort of, now I'm not saying that we should have more death, but when you have more high profile death, I think you get the rise of the unhappiness sentiment might be there.
Yeah, they can say it's not related to the jab, but what we are seeing is there is a rapid rise in the young sudden death. So much so they have to give it a name. The sudden adult, it's like sudden infant death syndrome. So it's sudden adult death syndrome. Why do you have to give a name? When it's not something to be concerned about. And many of these young people who died, it really is a shock to the family.
Yep.
And you read about the reporting, and many of the family members say, my child was totally well. There was no warning sign or whatsoever, and suddenly he or she is just gone.
Yeah, this just reminds me of the very young Indian boy who died as well. The parents were unhappy. Then after that, we don't see.
We don't
what's the
hear any
results.
news. Yeah.
And that's the thing that is always in Malaysia, right? Then the authority will come and say, don't lodge police report, withdraw the report, and things like that. Every time there is some sensitive issue, you get some people will go and settle it. And yeah, unfortunately, I think if you give enough compensation, people will be just like, okay, just move on.
I guess with the TGA, one of the case that was reported, the family member tried to raise some concern and complaints and things like that, but it's like they were just not going anywhere, and no one is willing to listen to them. And I guess it really, there should be enough voices, or rising voices to voice out this type of concern, this type of wrongdoings, basically.
Yep.
Yeah.
And which leads us to the final article, okay? And Lanshi, maybe you'd like to read the title and then run a bit with us, and then we see what we want to ask.
The pharmaceutical industry is dangerous to health. Cannot be. This is just about said. Further proof with COVID-19.
And mind you, this article is by Surgical Neurology International and it's published in NIH UK website.
Yeah.
And I would say, I haven't read the entire article, but almost the whole thing. It is almost like an establishment kind of article. It's not from the contrarian. It's not from people like us who are questioning. These are like I don't know how you call them. I mean, establishment may be a bit too strong, but it's like they're
the professional.
yeah.
They're not the conspiracies.
And I think to be fair, they say, look, Big Pharma was not the first and will not be the last. They point out to tobacco, to telecommunications, of course. But maybe you can just sum out with us what did they do and what was the result. And I think from there, we will try to raise some issues of interest to our listeners and viewers, and we'll try to wrap up this episode.
Yeah, I mean, the article is really long, and I just briefly read through this afternoon. And look, I mean, pharma company, the way they their involvement, even at the especially in the clinical trial stage, it's before COVID-19. There was already many main chief editor who came out and voiced out their concern back in 2015, way before COVID, and they say the way clinical trial is being done, there got to be some review because some of the data are just not true. And also they acknowledge that there is that pharmaceutical company who basically the whole study is just biased towards what the pharma company wants. When clinical trial started off in the academic setting, in a university setting, in a teaching university setting, and what happened was it was just taking too much. It's too time consuming, taking too long a time to come up with a clinical trial. And then eventually the pharma company decided to take things into their own hand and start to hire doctors to run trial, for their new drugs and things like that. And some even go as far as hiring like a ghost writer, someone who just write totally no reputation, don't know what's their qualification, and just write up some article and then send it to a more reputable scientist, and then get the scientists to publish the article on their behalf. You see things like that. That is what is written and reported in this article. And also they say how pharma company has the lobbyists to basically lobby for governmental political support for their products. I mean, these are all not new, but suddenly in COVID-19, somehow people just become, I would say, insensible, especially the medical doctors. Why all these doubts that was raised before COVID-19, the skeptic attitude towards the pharma company, it was there. But towards COVID-19, it's just like, it's not there anymore. It's like you just follow. If mRNA vaccine is good for you, means it's good for you. And just trust the scientists.
And I mean, we kept saying, look, if enough bad news, if enough exposure, then the tide will turn. But it seems like the big pharma are much more resilient. And I think one of the commentators, we're just showing you the discussions. Now, of course, one of the things is just their financial power, their link with government. But another thing which I think is really more prevalent or the more modern world is basically health and wellness are the new religion.
That's right.
And people kind of value that above and beyond many things. And it's like people are so willing to spend. And when you are so invested in health, you tend to want to believe what you want to believe. And that's why one of the keywords in this article, they are talking about behavior modifications. But of course, they use stronger words also, falsified results, fake studies, which to me is just criminal. It's not just conflict of interest, it's really criminal. But I mean, it goes back to what we discussed the last episode. Tyranny only happens if you allowed it. Yep. And unfortunately, I think many people contributed their role because they worship health and wellness.
Pharma company is exploiting this type of
And we
need.
kept saying, you know, and you yourself is in the medical field, but you also felt that, you know, people are unwilling to come out and say things because their livelihood is linked with that, their industry is linked with that. So it's not just the processing part, but I think it's the wallet part also.
That's right. It's almost like the cancelling culture, I would say, that we are seeing, you know, with all this crazy thing that's going on, the self-censorship.
Yep.
You know, what if I say something that is against what most of my colleagues saying, what would happen to me, for example, what would happen to my practice? I think in Malaysia, the implication is still quite, you know, is still quite negligible. But some of this implication can mean like one losing the medical practice license. You know, for some of the doctors who spoke out quite courageously in US. Yeah.
Yeah, I mean, even like Dr. Jordan Peterson, right? His license was just being reviewed.
Yeah, and that's really whoever has a dissenting, and he's not even like dissenting, he's just having a different point of view. And it's like you can't, you know, there's a whole, like you say, cancel culture, and that kind of facilitate the whole, you know, you're in your own echo chamber, you just believe whatever shit that is presented. I think that unfortunately is the indictment on the medical community right now. So time will tell if people wake up. And of course, one of the things I think also why it can happen is you fortunately, I would say the widespread serious adverse effect of vaccine is not there. I mean, I'm talking about direct adverse effect. Of course, I'm not saying that it is acceptable or anything like that, but we haven't seen the kind of implosion that will cause everyone to be like, you know, it's like suddenly everyone who took a certain kind of medication have an absolute certain kind of risk. Then that's a totally different ball game already.
Yeah.
So we haven't reached that. I don't hope for that to happen. But here's the thing, you know, all the players in all this. I mean, I call this a scheme, like, you know, where else, you know? I mean, we had the Ponzi scheme, we had the get rich scheme, but this is really a scheme to scam.
Yeah.
So I mean, even this NIH published article. I mean, if you have time, you are the kind of analytical, need a lot of information, need a lot of data to boost up your belief. Let me read the title again. The pharmaceutical industry is dangerous to health. You can't get clearer than that. Further proof with COVID-19. Fabian Jurelli, I think I'm not sure how to read his name. Very, very recent, just published end of last year. Surgical Neurology International is actually published on NIH UK website.
Yeah, that's right.
Truly remarkable. All right, so I think I want to wrap up already, but in terms of all the things we've been saying, you know, we know things are imploding, and we know the risk-benefit and analysis was never presented, never respected, and now, of course, we know all the big collusion. I mean, maybe both of you can just share like one takeaway. You know, where are we now? What can we do? And you know, what's your? I mean, I don't want to say word of encouragement because there's nothing really you can say. But what's the thing that maybe you think will be helpful to our listeners and viewers?
I think we have been talking so much about do your own research. Read more. But also, I think all these things are sufficient to tell that there has been a lot of suppression of data, that we really need to just wake up. I think
that's right.
I can't, it's just like what we have been talking about. I mean, even in what Vigilant Fox was saying, tyranny is not possible without compliance.
Absolutely.
So I think people really need to just come to a different perspective. It's like you have been so conditioned to one way of thinking. Perhaps after seeing all this data, if you want to talk science, you talk science all the way. And really just come into that conclusion and maybe there is an alternative to all this thing and just find out more. I mean, even you'll be very surprised that the data that is being presented in the mainstream media versus those alternative media be so completely different, and that might just save your life or save the lives of the loved ones.
Yeah. To me, I would be like, I'm at the juncture where I felt like, what would be the next phase for medicine? How does medicine look like without, for example, all this
No big pharma.
no big pharma, correct? No big government, decentralization. Then how does medicine look like then? These are the things that's playing in my mind, and I'm just thinking like, what is the? You look at many things that's many fields, like for example, business, for example, tech, for example, fashion. Things are progressing well, but medicine is one of those fields that it has a lot of old element in it, and it's almost like a religion. It is hard to shift. And in Malaysia, of course, because we don't invest a lot of money in research and development, and hence there is it's lack of creativity. But not talking about the technology and things like that. Of course, there's a lot of advancement, but just generally how medicine is being practiced, I can't help but to wonder what is the new medicine look like. Yeah.
Or maybe even how new insurance company will look like,
Yeah, that will be very, very
new
interesting.
financing system.
Yeah.
Because as you mentioned this, I think we'll close with this, and we're just saying that this 1 week, look at the headlines concerning medicine in Malaysia, where one public hospital cannot cope with sudden influx of emergency case, with another one where a psychiatric patient tried to go and use a sharp weapon. Then we have the health minister to say we have not enough money to hire doctors. Then we have doctors who say they want to go on strike, all in 1 week.
Correct.
So I think the medical community, I think it's a ripe time for, we use the word reformation, because you need to reform if you want to remain relevant. Otherwise, you just become the elephant in the room, the dinosaur in the room.
That's right. I mean, even things like what is affordable healthcare? How does it look like? Because free healthcare is just not sustainable.
Yep.
With matter of time, we need to think how to find the money.
Yep.
And I think quite likely we will be at that type of, we'll come to that junction.
Yeah, 100 years
Probably
ago.
sooner rather than later.
100 years ago, there's no such thing as health being taken care by the state. It is a relatively new invention, and that's why, we say that the health and wellness have become a religion. So maybe there could be another episode, because, decentralization of medicine, I think we are maybe heading there. All right, that's all the time we have for today. So thank you, Lan Shi and Lyra. So hope you enjoy the discussion. So
Yes,
until next
very
time,
much.
bye-bye.
Bye.
Bye-bye.